high school, my world shifted overnight. My mom was diagnosed with breast cancer, and as soon as that happened, everything that I thought was normal shifted. School routines, lunches my mom used to pack. Honestly, the sense that someone was always there to look after me disappeared. I started packing my own lunches, working part-time, managing my own schedule, and tried to hold myself together for my family. No, for me. It felt like I had to grow up and fast forward, skipping over the part of being a teenager where you still get to lean on others. It was overwhelming, but it taught me something about myself: resilience, independence, and the ability to adapt. And at the same time, it showed me just how fragile life can feel when health is taken away. What I went through isn't only my story. Many young people experience something similar: an illness, financial stress, or gaps in the system that leave them carrying responsibilities far too heavy for their age. The thing is, illness doesn't just affect patients. It ripples through families, friends, and communities, and it reveals inequities. Some families have stronger support networks, access to resources, and financial stability. Others don't. When I realized this, I started seeing health differently. Not just as an individual issue, but as a collective one. My story was deeply personal, but it connected me to a much bigger truth: that none of us face these challenges in isolation. Today, we live in a day and age where these questions are not only important to us, but truly urgent. Access to healthcare, family well-being, and support systems are being tested, whether by cancer, pandemics, or economic pressures. I'm grateful today that my mom is healthy again. Her story had a positive ending, and every day I'm thankful for that. But I also know that not every family gets that outcome. The unfortunate reality is that for most, the resources aren't there or support systems fail. That reality is what drives me, because health shouldn't be a matter of luck or circumstance. When I think about the future, I don't just see my own path. I see all the people whose stories sound like mine. The classmates who are balancing school with caring for siblings, the friends who work through late shifts to help pay bills, the families who navigated illness together without enough support. These experiences remind me that resilience isn't just simply about pushing through challenges. Saying is easy, doing is the hard part. Real resilience is built when communities and systems provide a safety net, so people don't have to face impossible choices alone. I'm studying global health, but no matter what degree we are pursuing, this class isn't just about getting good grades and graduating. It's about all of us preparing to transform these lessons we learn into actions we can take. Whether that means advocating for stronger healthcare policies, addressing inequalities in education, or supporting families in crisis. I see not just myself, but each and every one of us as part of a generation that refuses to accept this is just how things are. My story began with my mom's diagnosis, but it doesn't end there. It drives me to imagine a future where no young person has to grow up before their time, and where health and dignity are rights, not privileges. That's the change I want to help create. That's my story of self. So what's your story?